Okay, good afternoon. This is Sue Mintonen, Vice Chair of the Council for Human Services. Permit me to confirm all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Tara Rastiri.
Here.
Suzanne Keating.
Here.
Kelly Steffen.
Here.
Sarah Wright.
Here.
And Sue Mintonen, I am present. Staff, when I call your name, please respond in the affirmative. Jericho Melee.
Here.
And do I have Alexandria here?
Here.
Oh, thank you. I can't see you. You haven't spoken.
Oh.
And I don't believe there are any anticipated speakers on the agenda. Okay, so this is an open meeting of the Council for Human Services being conducted in a hybrid modality pursuant to Chapter 20 of the Acts of 2021. There will be an option for public comment, although there is no public members here at this time. And for this meeting, we are convening by video conference via Zoom, and is posted on the town's website, and people can join via the Zoom link or watch it later on YouTube. Is that all that I need to go through? Oh, and please note that this meeting is being recorded. So we've established quorum. Could I get an acceptance of today's agenda?
What do I say?
So moved.
So moved. A second.
Okay, great. I'll take a roll call vote. Tara?
Yes.
Suzanne?
Yes.
Kelly?
Yes.
Sarah?
Yes.
And I am I, so that's unanimous. We were supplied with minutes for July 25th and August 29th. Are there any amendments to the minutes, or is there a motion to approve the minutes?
I'll make a motion to approve.
Second.
Okay, roll call vote. Tara?
Aye.
Suzanne?
Aye.
Kelly?
Aye.
Sarah?
Aye.
And Sue, I. Thank you. This would be the time in the agenda if there was any member of the public that wanted to make a comment. Seeing none. Jericho's checking that there's nobody there. Okay. We were gonna do an appointment of CHS members to CRC. I'm wondering, Jericho, should we pause on that with the current chair of the CRC being a member of CHS and not present today?
I think following precedent, we can't nominate someone for a position that is not currently in attendance. I would suggest that you, since you are the other person likely to receive that we should confirm that just to get that out of the way as quickly as possible.
Okay, so we can vote on at least one seat from CHS to the CRC. Do we have any nominations or questions?
I'm just confused. We just approved the minutes from the July meeting.
Yeah.
Now we're.
And August. I list.
Blanket,
Yeah.
okay.
Yeah.
So I'm a little confused because in the July meeting, we said. The next meeting will need to focus on election of a chair and vice chair, as well as Sue and Veronica's reappointment to the contract review committee. So then on August 29th, you and Sue, I remember this, were it was accepted by all but we didn't discuss the CRC.
Correct.
Yeah.
We didn't, so when we were discussing it, we did not get it on the agenda for the August meeting, essentially.
Okay.
And then I think we ended up eating up the time. You can't introduce something like that without it being on the agenda ahead of time.
Oh, that's, okay,
So last meeting, we did vote in the chair and vice chair of this body, which
Yeah.
happened to also be Veronica and myself.
Okay, got it.
It's just a coincidence.
Okay.
So now we can nominate one person for the CRC from this body, if anyone.
I would like to nominate Sue Mintonen for the CRC.
Is there a second?
I second that.
Okay, any discussion? No. Okay, we'll take a vote. Tara,
Aye.
Suzanne,
Aye.
Kelly,
Aye.
Sarah,
Aye.
Sue. Sure, why not? Aye. So that was unanimous. Thank you for your faith in me in that role. I look forward to next week appointing the second member, or next month when we do that. But I guess I can say at this moment, since we are talking about the CRC, that Veronica was voted as chair of the
Oh.
CRC at the last CRC meeting.
Wow.
And
No.
we voted a co-chair, a vice chair, Joanna Roach, who's the representative from the finance committee.
Wow.
So there's some shifting happening at the CRC. And we're working diligently on getting our process adjusted, not fully changing over, but taking in some changes where we can to get this process done efficiently this go round.
Great.
Knowing that there'll be more to do in the spring.
Yeah.
Oh yeah, I think next on the agenda is my director's report. Sorry,
Yes.
I have a caffeine deficiency right now.
Oh, yeah.
Let's see, so I mentioned that we have resumed clinic operations for COVID and flu. We have 2 scheduled COVID and flu clinics on October 5th and October 19th. Those will be in the elementary school cafeteria, and then the signups can be reached on the Health and Human Services webpage through the town's central homepage. Additionally, we've covered sort of the highlights of it, but we're in the midst of approving the application process for the contract review committee. Is getting all of our dates lined up for provider interviews and grant presentations, as well as finalizing a slightly modified version of the request for proposals and the rubric. We expect to release that next week, assuming everything goes well tomorrow. And then that will be collected approximately 1 month later. So we're looking for a collection date of more or less the beginning of November. And then judgments should be released, or rather recommendations should be released well ahead of, like, I think probably before December, I believe. I don't think we need to go into too much depth on the actual specifics of that until we have the joint meeting with the select board in the next month, just because that'll give more context to what and why we're doing.
Mm-hmm.
And then COVID clinics, I'm pushing ahead with some strategic plan initiatives through the Healthy and Vibrant Community mission statement or goal. Currently, we're demoing a new financial structure to incentivize some new programming. The first one of which will be a wellness program through the Lighthouse School and then MAST. It's a educators program for any educator on Nantucket for like breath work, mindfulness, that sort of wellness. Looking to collect looking to trial both data collection for impact and efficacy in terms of like self-reporting for the people participating, and then kind of doing an experimental run that'll give us a better idea of how to implement things next year. Past that, Rocky Miramontes, the new health director, has been in place for approximately a month now, getting him up to speed on all of the peculiarities, shall we say, of Nantucket's health and human service world. He's got a really strong background in a variety of things that are my personal weaknesses, so I really appreciate having him around. Then we should be moving on to doing some health and human service strategic planning, like at the departmental level in the next couple of weeks. So possibly I might be soliciting some ideas from you guys as to things that I should be asking for there. And if not, I will be trying to make sure that we build in a planning system that acknowledges the connection between health and human services, and then building forward from that. Budgetary process is underway, so fiscal year 26's off-season behavioral health offerings will be figured out relatively soon. We're looking to roll out our question, persuade, and refer mental health training, as well as some other behavioral health trainings for island residents, for professionals in the area. There's a public health excellence work group that that has some epidemiological resources that are otherwise unavailable to me. So I'm hopefully gonna start getting some behavioral health epidemiology done in the next year or so. Other updates that are not directly human service related include a tick-borne illness summit in collaboration with that public health excellence group that includes the epidemiologist and a wildlife biologist. We're going to be getting them and some subject matter experts and researchers on the island together at Dr. Leprey's office next week, hopefully getting some tick-borne illness related education and outreach done ahead of next summer. We're also tightening up our surveillance, our mosquito surveillance program. There have been reports of triple E and West Nile virus in Massachusetts. We have two buffer communities, Dukes County and Barnstable County, which do a lot of ongoing epidemiological surveys of ticks. I do not believe there have been any
Mosquitoes.
sorry, yeah, ticks on the brain. Hopefully not in the brain.
Yeah.
But the mosquito, so there's a buffer zone between us and the other areas. We don't do disease testing of mosquitoes, but we do speciation and population counts. So we're actually going to be working over the course of this winter to expand the contract we have with, I believe it's Vector Disease Control Industries, to expand that to a wider net and more kind of in-depth epidemiological testing of these. But we have two communities that would be identified as having these things first, so with a little bit of a buffer in that sense.
Is it okay to ask a question?
Yeah, of course.
So how would we know if there was triple E on Nantucket right now? Because none of these studies have been done, right?
Well, so we can't know with absolute certainty whether or not there are triple E or West Nile positive mosquitoes. There have been 0 cases or 0 patients with symptoms that resemble them, nor have there been any human cases in either of the neighboring counties. Those counties do the disease testing, and they have found small numbers of positive, like I think there were 2 positive mosquitoes in Dukes County, and I think there were 3 positive mosquitoes in Barnstable at the last time I checked. We also have the epidemiologist I mentioned earlier keeps an eye on all of the reporting in the area. If there's any indication of human cases, we'll know within about an hour or 2. And then all of the various health providers on Nantucket know to add that to their diagnosis checks. So if there's anyone presenting similar symptoms, they'll be tested very quickly, and that'll get reported to the state, and then we'll have additional resources brought to us. Hopefully for next year, this isn't going to be a concern. We'll be doing active surveillance at all times. Or at least
Derek,
during
I have 2 things. First, a question about this public health, I forget what you called it, group. Excellence group. So is that a Nantucket, town of Nantucket or county of Nantucket thing? No.
That is a state-funded work group that's designed to incentivize collaboration between health and human service departments across its regional service area. This particular one applies to Nantucket and Martha's Vineyard. It's a on the ground level. In Dukes County, they have multiple municipalities, so they can share different health inspectors across them. We don't have that option here, so the value add for us is the access to the epidemiologist and the tick biologist.
Yeah, I was just excited to hear how we got an epidemiologist in our fold.
You get a certain number of hours a week from them and it's split amongst a few different municipalities, but it's the kind of thing that like we literally could not do until partnering with this organization.
Sure, yeah. And the other thing I had was a suggestion going back to the event were talking about,
The Tick Summit.
no, previous to that with this, something for educators.
The
Oh,
wellness
they-
program. for
yeah,
the
the
school.
The wellness program for educators, and
TPR.
I wanted to add suggestions of wellness programs for wellness providers.
Elvis all the way down, I believe. This is a trial program to help me work out the administrative kinks of doing these kinds of programming. It's also a way for us to collect data that would be helpful for organizations to reach out for grants to independently fund these things. I personally think that mindfulness, wellness, and then even and more direct, like straight material behavioral health resources need to be more prevalent locally. And then I think we can approximate increased service delivery by increasing efficiency and by kind of doing a better job of more handoffs, making it available and accessible to people. And I think that is sort of the long-term plan of both this body. It's certainly the long-term plan of Health and Human Services, and it's the long-term plan for, I believe, this body and CRC as well, increasing the total amount of funding going towards these kinds of services.
For sure. I just wanted to throw out there that we should not let our providers burn out. Not that teachers are not providers and do not deserve all the wellness opportunities they can have, because they absolutely do. Does that wrap up your report?
I mean, I could probably prattle on for another couple of hours, but I'll
I don't want to stop you from getting out anything really important, but
no, that was all the major things that I had set up.
that's a lot. So yeah, I don't not appreciate that you have a lot on your plate. So thank you for sharing all of that. So next on the agenda is continued discussion on the mission and goals of CHS. Did we have anything specific? I found out, half an hour ago that I was chairing the meeting. So I didn't put a lot of thought into topics yet. So I'm open to if there are thoughts or ideas about the mission and goals.
I think that we kind of need to hold off until we have our meeting on the 7th to really kind of
Yeah.
thoughtfully put into, because I just feel that anything we would do now may be premature. Yeah.
I think
So,
that's fair.
so I think I remember us putting this on as basically an ongoing discussion
Yeah.
as we're doing this. I think that even if it's something that we just go, nothing new to add this month, we should basically keep it on the agenda for the foreseeable.
Yeah.
Yeah, I agree with that. So then that brings us to the grant application and rubric. Did
So
you
I-
want to? Go
I
ahead,
can
please.
I can share that document to give you guys the basic outline of it. It is pending final approval. But what we have requires a tiny bit of context to explain. Which is that, there is a grant agreement that is a standardized form from finance, which outlines a legal and lawful grant agreement as, constrained by by procurement laws of Massachusetts and the bylaws of Nantucket. That section is probably not going to be included in what I'm about to share because that's something that would require legal review to change, and should have a pretty significant reason for changing. The exception to that is the rubric, which is included in the grant agreement, to show what the nature of the judgment and comparison will be for all of these different areas. So what I'm about to show you is the narrative questions, is what we've been calling them. They're the questions that ideally, in my conception of how this job, this committee's job is things that we will be checking on towards the end of the fiscal year each year, comparing to the performance of grants from the previous year and tweaking to get the most accurate information we can out of the providers, the nonprofits that we fund through grants, in order to ensure that we're getting the kind of programming we want to, the kind of reporting we want to, and that we're matching up what we're asking and what we're looking for to the needs of Nantucket. The core part of the equation that's been missing for many years is the lack of a general needs assessment for the island in general.
Yeah.
As a result of that, that's the major recommendation from our consultants, is that we need to do a regular formal needs assessment that is broader than the hospitals.
Yeah.
The hospital has a specific
Very
health
specific,
one that they're
yeah,
doing.
yeah.
So the questions. So what I will very briefly show is the draft narrative section. These are questions that have gone through 2 cycles of review with CRC now at this point. And correct me if I'm wrong, Sue. Like, we looked at it, we looked at the previous one, we had a meeting together, and we're approving them on tomorrow, on Friday.
Right. Yeah, the CRC members had multiple opportunities to give feedback.
That meeting's tomorrow at 4?
9 AM.
Oh, 9 AM.
But that is going to be I think that's gonna be our standing, like, regular scheduled
Okay.
meeting for that.
For the CRC,
So
is that something open to the public?
all of these
I think,
meetings are
yeah,
open to the
that's why
public.
And we can go to them if we.
Oh, yeah.
Yeah,
Anyone can attend any of these meetings
And
at
where
any
is
time.
that gonna be at 9 AM?
Here,
here, but
Okay,
I think it has a Zoom link too.
it does have a Zoom. So I think I'm giving this computer conniptions. I will share my screen now, just for you guys to get a quick look at this.
it's gonna be a lot bigger for my eyes.
And I will move this now so that you guys can also see. Okay, so these are variations on the. Oh, you want me to
Can
drop
we
one?
turn the lights? Yeah, it's hard to see that screen, sorry.
Is that better?
It is.
You wanna move over here?
I might move over, yeah.
Alright. Here,
That's okay.
We'll flip.
So these are, so there's a variety of questions that are included in the, there's a variety of questions that are included in, or there are a variety of,
Subtopics?
well, it's more that there is certain elements that are part of the grant agreement, certificate of insurance, those kind of,
Yeah,
like
yeah.
the specific legal requirements for us handing it out. Then these particular questions are designed to answer the things that committee members have asked in the grant presentations
Yeah,
and things that have come up at the quarterly reports.
got it.
There has been tension in the past over whether or not we evaluate an organization as a whole or a program only. This is the kind of, we're sort of threading it a little bit here, but basically we want to know what the requesting organization, what their state, like what their mission statement is. How does that mission statement connect to the program that they're asking us to fund? And then their organizational history, a brief outline of who they are and what they've done. The next thing we want to know, and this has come up quite a bit, is what the timeline of the program's operation is.
Yeah.
A big part of both CHS and CRC is word of mouth, spreading the specifics of programming that might not connect with members of the public.
Can I ask a question? Are you looking for any feedback on this from us, or this
At
is
this-
done and baked?
At this point, no. When we do so we're under a pretty significant
Yeah.
time crunch this year. When it comes to the facilitated session in the spring, it's probably gonna be multiple sessions.
Yeah.
That is when your feedback is like welcome and necessary.
Yeah,
But
Is
for
that,
now,
that
this-
first question
sorry.
is something that where you're threading the needle, I have an idea of how to deal with that, which is how we do it in Connecticut.
I think that's a solid idea, and I think that when we do that joint meeting.
Yeah.
Especially having the consultants there to kind of like. To provide clarity and organization to a lot of the things, I think that's where the most amount of feedback would be helpful.
Okay.
The other important part is that's gonna happen in that is that we'll formalize the relationship between CHS and CRC in terms of what degree of frequency of feedback,
Yeah.
what particular role does CHS play, and how does it inform the decisions of CRC?
Okay.
To describe the proposed program and project, this is, I mean, myself and the committee members, and Sue, hop in here at any point, please.
You bet, you bet.
This is the section where we want to know what, they're gonna do with the
Yeah,
money.
sure.
In the past, we've had issues with use limitations on the grants where a single sum of money is awarded to an organization for multiple different programs. This is where we make explicit what each program will be, and then when it comes to finalizing the grant agreement, what the use limitations of that money is.
Yeah.
And then this is one that has popped up, our services provided by this program in person or remote. As part of the increased attempt to match grants with needs,
Mhm.
this is one of the questions.
Yep.
Who is going to receive these services? What do you know about that population now? How can we, especially in continuing programs, what is the trend line of your previous years' usage of these? Then we had some nitty-gritty financial kind of questions that we didn't have a standardized reporting form in the past. So these are going to be the provider
Mhm.
given information that we're gonna request right in the bat, so that we have a summary of what the structure and large scale organization of the program or organization will be. These are just operating budget, total expenses in same fiscal year, net profit loss, full-time employees, part-time employees, number of on-island employees, other grants, including previous year CRCs, so we can get an idea for how much fundraising, how much other areas people are looking for. And then a second section here, which is more specific to the program, the anticipated program budget, which is going to be what they think the total program will cost. Staff expenses, which will be working time for that particular organization. Supplies, equipment cost for program. If there are non-staff related costs, licenses, et cetera. The program start and end date. Part of this is for redundancy, part of this is because when we do the final report to FinCom at the end of the process, when we make our recommendations, we'll have a solid, easy to understand summary of the nuts and bolts of a request, and then a description of what it does. Then just program reach anticipated for that particular current year, and if it's an ongoing program, how many people have they reached in previous years? Next is describe the needs served by the program, and the methods used to determine that need. So this one is a demographic question. Who will it serve? This is the more narrow description of what is the need. And when we have a community needs assessment, you will be directly referring back to which community need identified in that needs assessment that is being addressed by this. So I think the general plan is to have a 5-year recurring needs assessment. Every 5 years, we would come back, get the information out, and then readjust the grant application for that current year. What are the specific goals of this program and how will you measure the program's success or failure? So we just really need to drag things back to an empirical way of determining what it is, how will you judge whether it succeeds or fails, and then how will you adjust in the following years? 8, what partner agencies, organizations, or groups will participate in collaboration with you for this program? Please describe your partners and their role in the program. Through the Youth Behavioral Health Grant, we realized that building a degree of interagency collaboration is a good idea. Trying to make that an official thing that we use to make judgments on who we'll fund and who we won't fund is what this is. So this is something that we learned about from the Youth Behavioral Health Grant that is good enough to apply to literally every other grant we do forever. And then this is where they make their official request for how much money they're requesting. If there is a difference between operating budget for the program, and this will look to see what other funding sources they're looking for, whether we're providing a portion of funding for a larger program, how sustainable that program is, and because we have a limited sum of money, and if we have to award less than the request, how will you adapt to that? It's an unfortunate truth that we don't have enough money to fund every worthwhile program that comes in to the full amount necessary of the request.
Sure.
So this is a way for us to build in a gradiated response and a gradiated amount of funding. Please attach or paste a detailed program budget and the previous year profit and loss statement for the organization as a whole. This is just sort of I'd like to see like a more thorough expanded of the itemized budget for a particular program to the degree of detail that they have available. Was there any major questions on that?
No, I would like the opportunity at some point to provide some feedback. You answered two of the 5 issues that you answered in further questions.
Let me know what the questions are and I can give, like, I think it's not necessarily appropriate or
Yeah.
good idea for us to change things right now, but
Yes.
I'd be happy to answer any questions you guys have.
I'm just curious who put together these narrative questions.
Me,
Okay.
me and so these are a edit and refinement of questions that we put together for the Youth Behavioral Health Grant that we then adopted for last year's one. They're largely based on questions that were adopted by the CRC, even as far back as before I was with the town. The original grant agreement for this dates back to the 80s, I think, the late 80s, early 90s. And this is one of the revisions we're trying to do to make it comport with best practices for the day.
Oh, good job.
I had paid consultants and then a whole CRC group and then also finance, so I had a lot of help.
Very specific. Good.
Yeah, so we have really expanded the role of CRC in the last 4 or 5 years post-pandemic. And we've learned a ton as a result of that.
Mhm.
I think that's mostly all I have to say on that. Sue, did I miss anything?
No, I'm just really impressed at how you took the mishmash of questions that had A, B, and C. I mean, there was a lot going on
It is
and
a
it's
long
down
one.
to 10.
That we had about like the charts and like basically cram about 10 questions into one section. And I'm sure that when we do bring this to the joint facilitated meeting with the consultants down the road, they will have additional input, and I know that Tara has stuff that could be tightened up on this as well.
Yeah,
Yeah, they're
I
good
mean,
questions though. I really, when I think
It's-
about asking these of the partners, like the community partners I work with, they're all they'd be really informative answers.
And I think that's
Yeah.
sort of like, the idea is that everybody who reads the answers to this has a good idea of what the proposed program is and can explain its nuts and bolts to other members of the community in a way that both justifies the expense and explains what the program is, what it will do, and how do you use it. Because we certainly have programs that I am reasonably certain that we have a need for that are underutilized or underattended. And a ton of that is because of how we acquire information on Nantucket, which is largely word of mouth. We can do as much social media as we want. We can have posted advertisements. We can have physical flyers in locations that people are common in, and it will not get to people as effectively as rumor or conversation.
Yeah.
it's very true. And as a person who has applied for grants from the town for various agencies, this is all starting to feel much more cohesive. like applicants are probably going to feel better about this.
And it's gonna be
year-over-year.
coupled this year to a couple of like a more consistent schedule, which should allow for better preparation by the people who are presenting. A longer period of, and a longer open period for submissions, which should lead to better, more supported grant requests. And then, ideally directly connecting it to data that's being collected by the agencies, both to see how well it's working on the people who are utilizing it, and to check how effective or efficient it is at allocating funds.
And Jericho, if I'm correct, we are hoping, the CRC is hoping to have sort of an open house Q&A for applicants.
I think there should be a scheduled meeting during the open period for all providers to come to the committee as a whole. And then even that, I will also have office hours on a semi-regular basis for people to either come in and ask me questions, or to make it so that it's a less mysterious process. It's more transparent and responsive to the providers, because it's a partnership between us and the providers. We need to treat it that way.
Yeah, I think having official avenues for folks to get information. I know in the past, there's been like kind of one-on-one meetings, and I think we're trying to steer away from that situation unless it's like, or an organization meeting with you.
Yeah. I mean, I have no real dog in the fight as it comes to outcomes. So, I mean, I'm the neutral provider of information here, and I'm also the person who is professionally and legally responsible for the usage of this money. So that kind of gives me a neutrality, where I'm looking out for the best interest of the town as a discrete entity. But yeah, that's sort of the theory and practice as it happens so far. There's going to be this cycle of the grant allocation process is going to be, I think, an improvement on previous years in terms of just being more modern, and more similar to other grant processes in effective ways. And then I'm sure this is we'll never have the perfect grant process. It's always a process of improvement. And one that I'm increasingly realizing is very significant to how Nantucket functions and how well people are here.
Yeah. Great.
All right, I'm gonna turn the lights back on again. And then I'm gonna stop sharing. If anyone has any more questions on this, feel free, email, call, whatever. And then we should have this in the rubric done by tomorrow, which means we'll be releasing this grant out, the grant requests out the following week.
Okay.
Please, next week, if you know of anyone who works at a nonprofit, let them know that the grants should be up. The grant application will be the notification of the grant will go into the paper for the next 2 weeks. Then we will also have it on the Health and Human Services webpage, and I'll be asking town social media to share it around. I'll also be sharing it with the previous providers, previous grant requesters, that whoever's email I have had over the last couple of years. And then we'll also be sharing it through the community foundations, basically the community foundations mailing list, and then hopefully Healthy Collaborative once it's all together.
What's that
Will you be
window?
able,
Oh, sorry,
go
Sue.
ahead, Kelly.
What's that window? The grant application is open, like the window that people can apply?
It should be, it'll be 1 month from the day I release it. It'll be 30 days from day of release. I'm hoping to have this finalized and released by Tuesday of next week. I want to run parts of it by finance to make sure that we haven't made any particular mistakes. And then I want to give it enough time to know that I have to have changed all the dates and the actual grant, the the grant agreement that we're putting together, to have like all of the nuts and bolts that if I hurry, I end up putting the wrong information in or not catching a typo or something like that. So it should be released from, that would be the 31st, I believe. Either the first. I'll probably release on October 1st and collect on October 30th. Then I'll put together the packet. We'll start the evaluation process with the contract review committee.
When you release it and send emails to previous applicants, would you send it to the CRC and the CHS in an email as well?
Yep.
Awesome. So everyone can forward to organizations that might need the heads up. Tara.
And will you hold sort of office hours during those 30 days in
Yeah,
case that
yeah, yeah.
people, okay, so it'll be like a standing sort of,
It should be like, what I'll try and do is reserve a chunk of time, every week, more or less, for people to come, and then make sure that people know, we'll include,
maybe put that in the letter.
it's gonna be in the outgoing letter and in the advertisement with the
Yeah.
Yankee. That will have ongoing office hours for that. And then I believe, Sue, our plan is to have a meeting during the open time for people to come in and discuss it. Because I'm interpreting the wishes and desires of the contract review committee in the office hours. It's not my decision on how certain of these things are handled, and it won't be me doing the evaluating. So having a public open meeting with the contract review committee, for people to ask these sorts of questions on the record is something that I think is gonna be.
Yeah, because people will think of questions that if they hear somebody else say something or ask something, they'll be like, oh, I didn't think about that. Yeah, the open committee, that's great.
That is the thing that, like, the thing from the Greenwich model that seen that in the letters of intent, which
Yeah.
just due to timing this year, we could not get sorted out. But that and the letters of intent seem to be the magic bullet for a lot of these things.
Yeah.
Can you remind me what RFP stands for?
Request for proposals.
Oh, okay.
It's the document we sent out, letting everyone know, we want to hear what you're going to spend this money on. Technically, I think this is it's a legal term in addition to being something that we throw around in that. Technically, it's like a request, it's not a request for proposal because that has a certain specific thing that it is legally in the state of Massachusetts. But we've been saying RFP, or request for proposals.
Okay. Thank you for reviewing that. I think that was helpful for me to even just see it with this hat on, and certainly for everybody else, it's good to get everybody's brains chewing on this material.
Well, you are certainly gonna get your fill of it tomorrow.
Yeah, I sure am. Is there any other new business that people wanted to share? Sarah, you've got some stuff going on at the hospital. I don't know if you wanted to share any of that.
Well, yeah, thank you. So we have the health fair Saturday from 10 to 1. And we'll be giving flu shots in the clinic. The fair itself is upstairs on the second floor where it was last year. That's happening. And I think that's it for the moment.
Okay. Kelly, did you have any updates from any of your connections?
Not health related too much. We're releasing ag infrastructure study soon, in partnership with Remain and the Land Bank, and pretty research heavy, kind of soft and hardscape. It's really interesting, but yeah, kind of outside the scope of, other than the food is nutrition kind of stuff. It does advocate for like getting more local nutritious food into the provider end of our food security services, and then as a kind of a subplot, how we could do that locally.
Awesome. That's all very important.
Yeah.
Suzanne?
Anyone else? Yes, I have a question for Kelly. I'm not sure I know who he's affiliated with, or when you ask
Oh,
him
who
questions.
Kelly is?
Yeah,
Yeah, I work with a consulting firm called Process First. We've worked with a lot of the food security programming social services, as well as some of the other social services that specialize in other sectors. A lot of kind of tech advocacy, tech literacy, tech implementation. And then I kind of bridge the gap, and I'm a layman in the midst of a bunch of very smart data scientists.
Is
I'm
Yeah.
an
there-
interpret.
I'm curious if there's any way you can work with the Sustainable Nantucket organization. They do the food to the farm to school and all that.
Yeah. Well, I probably haven't talked about it a lot in this group, but a lot of you I think probably know about it. We did build and implement and it's still operable as a referral service called Food First, and all the food programs all the food programs on Nantucket food operators are in it as program like operators. And then I think the majority of social services have touch points with people who would need those services, use a platform as well, and they send in referrals, and then it's not a full intake process, but it asks enough questions that it can delineate where to send the referral, and then it's on the program operator just to update that profile so that we can kind of
I-
follow.
Yeah,
Yeah, like, so basically anyone who hits any of the social services that would touch on food, the
I
person.
remember
Yeah.
when,
Matt?
was it, somebody gave us a
Oh,
talk. Was it-
Yeah, Brooke and Meg a little while back, probably.
Yeah.
Yeah, we work really closely with them. Them being NRP, one of our biggest advocates for that referral platform, Food First, is Family Resource Center. We call them like a super user because they are just because
Yeah.
of how much of a benefit it gives them, but also the kind of the way they've helped us. They've informed a lot of its building process. But yeah, hopefully, I think that a lot of that just will hopefully accompany this work as our work as our work develops.
Perfect, thank you.
Yeah.
Suzanne, anything go ahead.
Yes, I
Sorry.
just thought of one more thing. If some of you already have touch points yourself, but if you meet anybody or kind of know someone who has touch points with people who need access to services, just learning about various services kind of in the food security realm, Family Resource Center again is where we send people who want to who aren't in the Food First system yet.
Okay.
That's all I
Excellent.
got, Sue. Thank you.
Thank you. That's awesome. Suzanne, anything out of anywhere you are that is health and human services related?
Over at the library, no, just the things we post and, different things going on. Not a lot right now.
Okie dokie. Tara?
Nope, all
I
good.
don't know. I don't know what you're up to. I'll say from my professional end that PassCon is doing a big push. We have an ad in the Inky every week. We're just letting people know about our support groups. They are free, they are confidential, and transportation is available thanks to our PassCon CRC grant funding. So I certainly want to plug the use of that because we found transportation to be a barrier for a lot of people to come. So all the support groups are held in a hybrid format, so people don't have to come physically, but we certainly welcome them to come and are able to transport. So just send them what's that?
We saw the ad this morning in either Daybreak or Nantucket.
Current,
Current, one of those.
yeah, so.
Yeah.
Excellent. That's what I want to know, is that it's getting out there. So we're happy. We'll be at the health fair. We'll be at the Senior Expo, letting people know, but they can visit passcon.org or call up our office. The ever pleasant Betsy Minahan is there to help people and connect them to whatever resources they need.
Right.
If there is no other new business, I would entertain a motion to adjourn.
Motion to adjourn.
I second that motion.
A motion?
Okay.
They both work.
Oh my, are we going to have to sing through our roll call vote? Tara,
Yes.
I did that.
yes. Suzanne,
Yes.
Sarah,
Yes.
2 thumbs up. Kelly?
Yes.
And I am an I, so thank you, everyone. The meeting is adjourned at 5:01 PM. We were very efficient today. Thank you, and I will see you all next month unless you pop into a CRC meeting before then, which you are all welcome to do.
Thanks so
Good
much,
night.
Sue.
Thank you.
Nice
On
to
the
see you.
town website.
Yeah, good to see everybody.
Where the agendas
Okay.
are, yeah, just look for the